Great day today. Magandang hapon po sa inyo. Gabi na pala. It's already 6 o'clock and it's now time for our free webinar again. This is another episode wherein we're going to give you a free webinar really brought to you by Dental Marketing Philippines. Again, I'm Roche Piruiz. I'm the founder of this DMP page, and I hope you join us today as we have prepared a very good topic for all of you. So we're very excited because our guest today is a good friend of mine. He's a great doctor. But before that, allow me to really greet you a very, very happy Monday. Today is a Monday, right? Okay, Monday. So Monday is always supposed to be the start of a great week. And I firmly believe that this is a great week for all of us because, as I said earlier, again, we are going to give you an unlimited webinar. Actually, we're going to do this until the lifting of this ECQ. Of course, some other cities are already GCQ, but we intend to do this until May 13. That would be initially our last and final webinar for this Dental Marketing Philippines. Okay, so this time I'm just going to give you a brief overview. We're very lucky that we were able to get a lot of presentation. So this is just a simple presentation I did. This is a dental webinar. The title of this one is What is Really Marketing? And also Clinic is a Business, and also discuss there the 3 M's of practice management. I'm sure you are all excited, as you can see my beautiful guest down there. And but let me just continue with this slide. So last April 10, I was able to discuss this done, and Dr. Stephen Almonte, we're also very, very thankful for him because he was our second guest, Leadership in Time of Crisis. Dito po, narinig po natin, nalaman po natin yung mga welfare and trust funds, saan ba ginagamit o saan dinadala yung mga budget ng binabayaran yung every year. No? As a dentist, of course, you're paying a regular membership for your Philippine Dental Association. I know that they do have a lot of questions, but we were able to answer some of the questions there during that particular interview. I'm very thankful again with the Philippine Dental Association, with your support, with Dental Marketing Philippines. I'm really, really grateful. As a small little guy and a small, in this business, it is really a humbling experience to be supported with the great men and women of Philippine Dental Association. And last April 10 po, I was able to share. This is actually the first time in the Philippine dentistry, actually. As a matter of fact, I was able to discuss konti pong protocol about dentistry. And just like this morning, it was actually validated by some of our great lecturer in Philippine Dental Association, headed by, actually, nag-lecture po yata kanina si Dr. My idol, Dr. Leo Gerald de Castro. So I was able to discuss about ano ba ang magiging epekto nito sa dental practice, ano ang magiging epekto nito sa dental business. And marami rin po natanong. If you want to get to see that replay of that video, you can check it out in YouTube. So nandiyan po ang links below. So, and of course, you can PM me for the link. And also, we're able to discuss about telemedicine with Dr. Luisito Ruiz. Actually, marami na po tayo na-discuss. But I'm just really grateful with all the support. And again, this is a great avenue, a great welcome development for the DMP, Dental Marketing Philippines, to all the dentists. Because I was fortunate enough to invite this top doctor in Texas, in the US. He was able to discuss dental marketing on value-based dental practice. No? Sabi niya po, marami siyang pasyente dati, pero konti ang kita. But when he applied the dental marketing concept of value-based dental practice, kumunti ang pasyente, pero dumami ang kita. So that's a great avenue of your practice. If you have to look into that, you can check out the replay also on that YouTube link down there. And also, I was also fortunate because this is a good friend of mine from Miami, Florida. Kasama po, kami po ang nag-lecture. I was the chairman in that Boston, Massachusetts Dental Marketing Lecture, and she's one of the lecturers also, Sonia Dunbar. And we have seen a great opportunity for mobile dental geriatric practice. Yes, geriatric. So it's not all about prosto. There are so many ways, so many still avenue for learnings in terms of geriatric population. Alam niyo naman, by the year 2024, no, 7% of that 100% is around 65 years old. No, 70% pala will be 65 years old and up. So it's a great avenue for your practice also, right? So again, and last April 18, I was again fortunate enough because I do have friends in the US that was able to discuss about bleaching, everything about it, materials, cases, and technical specifications. So we're very thankful to Dr. Arturo Pabia. He's the president of Globodent USA. And of course, no, ang dami na po nating na-discuss. So you can check out all of these videos sa YouTube, and you can go to Dental Marketing Philippines. All of you who are watching right now, you can share this. Dental Marketing Philippines, what can dentists do to protect themselves and their patients? Dr. Lilian is a good friend of mine. She was able to share some of the protocol even without pandemic yet. No, so we're just we're very thankful for his for her contribution to my presentation to Dental Marketing Philippines. Thank you very much. And last April 24, we're able to discuss with, we're able to talk to Mr. Kenko and introduction to Magic Core minimally invasive implant. So this is another avenue. Maybe after this pandemic, we're able to look into possibility of carrying this product. Now, yours truly is really here to really support, augment, and basically help you in the dental marketing campaign of your business. We know for the fact that business, your clinic is a business, your practice is a profession. Tandaan niyo po yan, no? So, as very thankful that a lot of people are opening up their mindset on that particular concept. And ito po, you know, dentists are human. We are all human beings. So, I brought along with me these two motivational speakers together with yours truly, faith, hope, and love from the Bible verse in this trying time. So, Mr. Malvin Denlasan, Mr. Ekon Malig, and yours truly was able to talk about faith, able to talk about hope, and really we have to have faith, we have to have hope, and we have to love, spread love to each other. So again, sabi ko nga po, we are socially distanced. So it's not socially distancing, it is physical distancing because we can still socialize with each and everyone online. So again, maraming salamat po sa suporta nyo. And May 7, today is May 4, so 3 days from now, we're going to have the dental architect, no? So Dr. Dental Architect po ang tawag natin sa kanya, is building a brand. Dr. Archie De Leon is going to talk about dental ergonomics. So much for that. This is a great topic also. And April 10, my partner, Dr. Kevin Mirasol, is a digital expert. He is going to teach you the dental digital marketing for social media branding for dentists. Exclusively, he is the life entrepreneur dentist. So he is really good at what he's doing, and I'm very grateful that he's part of this Dental Marketing Philippines. And on the last day of this seminar, of course, no, yan na naman po yung maliit na tao. I will be talking about the 3 phases of dentistry. I will also be talking about the new norms of dentistry. I will also be talking about magkano. No, a lot of dentists, kayo po, no, alam ko po, no, sawang-sawa na kasi HM, how much? Kasi ang dami po nagbebenta, mga bagong protocols ngayon. Kasi again, I would just like to remind each and everybody that no amount of devices, no amount of machine can really protect us 100% from this virus. But with the right information, with the right other, of course, extra equipment, and with the right discipline, that will definitely help us. And for tonight, no, this is the moment of truth, no? Interprofessional, medical, and dental. This is a great topic. Actually, I'm very, very happy. Also, yours truly is really a very fortunate individual because I was able to get a good friend from the medical side. And this lady is one of the very good friends now. So this is a great opportunity for me to say hi and hello to my friend. She's a pediatrician. I will introduce her properly before the start of the lecture. But let us just say hi to my beautiful doctor, Dr. Lilian. How are you?
Oh, I'm fine. Good. And I would like to thank you, Sir Roche, for inviting me here in this session. I'm honored.
Wow. Thank you very much, Dr. Lilian. I'm more honored. Hindi mo lang alam kung gaano kasaya because nandito tayo para mag-serve or saka tumulong sa ating mga dentista. A lot of dentists, sometimes, you know, pediatrician, there's a pediatric dentistry and there's also pediatrician on your side. So I think we're gonna discuss that later, but hindi ko muna if we preempt yun. Doktora, so you are also on ECQ, right there in your house. Tama?
Yes. Mm.
Uh,
Lahat tayo.
uh, so,
NCR.
kagaya ng sinabi ko kanina, paano ba ang ano, di walang duty, you are, I know you are frontliners, you are helping a lot of people to really, aside from helping them actual on the actual field, you are also helping them by telemedicine and telephone consultation, tama po?
Consultation. Yes, that's true. Mm.
Mhm.
But no actual clinics actually.
Mhm.
All clinics are closed.
Wow.
So we do consultation through media using Viber, Messenger, and there is this platform called the Medify.
Medify. Uh-huh.
Yes.
So this is an app, Doktora, tama?
Mm-hmm.
Mhm.
Yes.
Sige, sige. So there are actually a lot of people watching right now, and I also created a watch party, Doctora. We have 60, we have 59 already watching right now. So this is a great start. So of course, wag na natin patagalin. No, I think everybody is excited. Doctora CJV Monar, magandang gabi po sa inyo from Quezon City. If you do have questions, if you do have inquiries about what Doctora Lilian is gonna be discussing, don't hesitate. She will definitely will love to answer that. Okay? So, Dr. Lilian, I would like to introduce you. No, she is a
Okay.
pediatrician by profession. She is an associate professor in the University of Perpetual Health Rizal, and she is also researcher. No, parang ambigat. No, no. She's a researcher, and at the same time, she's a writer. She used to be the vice president for Las Piñas Medical Society. Of course, member of Philippine Medical Association. Without further ado, I'd like to introduce our special guest today, Dr. Lilian B. Rosario.
Thank
Doctora,
you.
take it
So
away.
yes. So I hope you'd find this interesting. So wait, I'm just going to set it up. Okay. So I guess everything is ready.
Yes, yes,
So
go
this
ahead.
is okay. This is what I'm going to discuss with you. So let me begin this by a Bible verse. You use steel to sharpen steel, and one friend sharpens another. So meaning to say that of course a helping hand would do a lot of wonderful things. Sometimes we could do things better or even best with this. So nothing to disclose. So actually, in reality, there is always this patient who's really confused on who to consult first or who to consult to, especially if we are dealing with issues concerning the head and neck, and probably particularly of the oral cavity. So, is it medical or is it dental? So, I guess all of us are doing this, but we are just unaware that we are already practicing this, what we call as the interprofessional collaboration. So my objective is to walk you through this, the theory for this education, and then the collaborative practice. Describe some relevant theories to this. Describe the core competencies, and then define the role of the oral healthcare provider, the dentist, in this collaborative practice. Discuss some connection of some oral diseases, of course, to systemic diseases. And this goes also with the oral microbiomes. Wait, it's hanging. Sorry. So I'll start with the case scenario. We have patient LY. So as you can see, this is his picture. So he's an actual patient of mine. 7.5-year-old male was brought to me due to palpable masses at the lower jaw and cervical area. And there was a decreased food intake due to painful chewing. So, past medical history revealed recurrence of respiratory tract infection and hospitalization due to pneumonia. So, he was a picky eater. He loves to eat sweet foods and has a good physical activity. But you see, the weight of the patient is like he is 2 kilos behind from the ideal body weight. And at the same time, This is the ideal height, but his height is only 117 centimeters. So there are enlarged cervical lymph nodes, the lymph nodes in submandibular and then at the submental area. There are a lot of dental caries, and there are pustular lesions that are present in the inner lower lip. So the thing here is um, this kind of issue is just centered for the medical practitioners, or do I need someone else? So it's quite a puzzle thinking that I have an ongoing infection, probably the head and the neck, or even the respiratory tract system is involved. But one thing here is that it is so obvious that the oral problem is very much present. So the thing here is it really medical or dental, or is it for both? So here, so you see there are three coffees here, Starbucks. I miss it. So initially, I called for my ENT friend, and then, of course, I had a chance to refer the patient to one of your respectable colleague who is a dentist but specializing in maxillofacial surgery. So I told them that patient LY is our patient. It's not only my patient, but our patient. So here I'm going to call for interprofessional collaboration. So, what is interprofessionality? It's the process by which professionals reflect on and develop ways of practicing that provides a unified or integrated, cohesive, or you have to fit all the answers together to meet the client's needs, particularly the patient's, so that we could optimize the healthcare delivery system. So here we have the milestones for the IPA and the IPCP. Actually, this interprofessional collaboration is not really a recent phenomenon. So since 1969, the Institute of Medicine nowadays, they are known for the National Academy of Medicine. They try to formulate strategies to achieve quality healthcare system delivery centering on the safety of the patient. So in 1972, this IOM, they start educating different disciplines, and then they created a health team. So this included nurses, doctors, dentists, pharmacists, and other healthcare providers. So what they did is that they made a research on how is this health team, is it beneficial or not. So the research was being funded by a wealthy family who owns an oil company at that time, the Pew family. So they call this research as the Pew Charitable Trust Report. And out of this, they get a positive report. This is very significant because they said that the IPE, or the collaborative practice, is one of the best solution to address healthcare system delivery. So before this 2000, there is what we call a book, To Err is Human. So it is in 1999 that there is a big publication of this, and the scope is, of course, to stop issues concerning medical harm. So this is an urge to practice an IP team-based care to prevent medical errors. So what are medical errors? Sometimes giving off wrong prescriptions, giving off wrong dosages, and of course, the worst thing is wrong referrals. So in 2000, this book was being launched, To Err is Human, and Building a Safer Health System. And in 2013, there is a journal of patient safety. They recorded that 400,000 patients per year suffer from preventable harm, and this includes your medical errors. So in 2001, the WHO, they conducted simultaneous lectures to bridge the gap between different disciplines because, of course, a dentist has another perspective, and us doctors, we have another point of view, and also that goes with the pharmacists and nurses. So, yes, so they build a team. And then in 2008, the Agency for Health Research and Quality efforts on retraining to build interprofessional teamwork and team-based care because of this positive result that indeed they optimize the healthcare system delivery to the patients. So in 2009, there's the Recovery and Reinvestment Act and 2010 Affordable Care Act placing increased emphasis on medical home population health, improve primary care outcomes because they found out that medical care or healthcare system is not a privilege, but rather healthcare system is a basic human right. So by this time, there is a concrete definition for this, like the interprofessional education. It was defined when students from two or more professions they learn about, learn from, and learn with each other to enable effective collaboration and improve health outcomes. So what about the IPCP? So it is of multiple health workers from different professional backgrounds providing comprehensive health services, working with patients, their families, caregivers, communities to deliver the highest quality of care across settings. So we have the interprofessional teamwork, the levels of cooperation, coordination, and collaboration, characterizing the relationship between professions in delivering patient-centered care. So why IPE? Now let me talk to you how important the role of a dentist in the practice of interprofessional collaboration. And this is what the Dental Quest Foundation reported in 2018. They integrated the primary care, behavioral, and oral care, and to address the following health needs in the 21st century. Okay, tackling the workforce pressures and gaps, demographic changes, aging population, chronic health conditions, technological advances, patient safety, quality agenda, healthcare and payment reforms. Okay, so interprofessionality requires a paradigm shift since interprofessional practice has unique characteristics in terms of values, codes of conduct, and ways of working. So we have the three types of professional competencies. Of course, for us, we have our common competencies and, of course, the individual professional competencies and complementary. But with IP, we have now the collaborative competencies. So the other domains here is, of course, since we belong to different health services, before they have found out that each healthcare services they are divided. We are divided, and because of this, we have a poor communication or at times no communication at all, particularly in addressing the problems and issues of our patients. So the losers here are not the healthcare providers, but of course the patients. So we have the competency domains. as a team, we consider the values ethics for interprofessional practice. This is the moral obligation to work together to improve outcomes. The roles and responsibilities, shared understanding of each person's roles and abilities. We have the interprofessional collaboration, which is the openness, the style, expression of feelings and thoughts aimed at modifying teamwork environment. And here we have the teams and teamwork. This is essential component of patient-centered practice. So let's go now on the role of the dentist. I told you that they are very important here. Why? Because the mouth, our oral cavity, is the main entrance to the human body. Okay, why? In the Philippines, I'm so sorry if my incidence report is way back 2011. They have said that according to the DOH, it has been reported that 87% of Filipinos, which is about 83 million, suffered from tooth decay. And about 77%, meaning 7 out of 10 Filipinos, they never had any consult to a dentist. And how about the children? 98% of which belongs to the age 3 to 5 years old, they have dental caries or cavities. And then 20% of the 6 years old group, they don't have any consult to a dentist. And toothache is a common ailment among school children, which is, of course, the primary cause of absenteeism from school. So here we have the mouth, the oral cavity, and its structures being exposed. So what am I going to do here? Meaning to say the oral cavity really is the gateway to the body. According to the Center for Disease Control and Prevention in US, dental caries is the leading chronic childhood disease. And periodontal diseases is reported among 47% of adults, and 1 out of 5 has unmet dental care needs because of lack of funds. And poor oral health has a direct proportion or is linked to poor systemic health. So here, so how this poor oral health affects us. So people with severe gum disease have a higher risk, 3 times to 4 times risk of having the brain stroke. And then this gum disease may be linked also to Alzheimer's and dementia coming from the oral bacteria that spread through the bloodstream. So this is the mechanism by which this diseases would be spread out to the different system of the body. So the next one here is people with gum disease are twice likely to have heart disease. So aside from brain stroke, Alzheimer's, heart disease, the next one is everybody knows what this gadget is. So if you have this, you are monitoring your blood glucose. So nearly 22% of diabetes patients have gum disease. Remember that glucose is creates a conducive environment for the growth of bacteria. So if you have diabetes, the next one is obesity. So there was a research in Germany that includes 539 participants. They were observed from birth until 31 years old, and they are being evaluated for gum diseases. So there was an increased risk of diseases seen with obese patients, and the standard risk is 33.3%. 14.3% had moderate to severe periodontitis, and 14.7% has bleeding or probing on clinical attachment loss. So heart disease, diabetes, obesity. Okay, for male. Okay. Okay, it was found out that gum disease is an indicator, meaning to say, if you found out that the male or the guy, the man has severe gum disease, always try to check for the prostate specific antigen, which is a tumor marker for prostate cancer. So more often than not, that they have found out that if uh, the male patient has gum disease, somehow the PSA has a higher level. That's why a gum disease is considered an indicator for the possibility of prostate cancer. So, men in their 30s with severe gum disease are three times more likely to suffer from erectile dysfunction. Of course, aside that it is a sequelae of having diabetes also. So from the head to the chest to your height. Okay. For women, so women with gum disease have a 14% overall increase for breast cancers compared to women without the gum disease. And postmenopausal women with osteoporosis are 86% more likely to develop gum disease. So, okay, the next one is, of course, rheumatoid arthritis. As you could see, they are 8 times more likely to have gum disease. But what's the worst one? The worst scenario is cancer. Okay? There is an increased risk. Oral cancer and pancreatic cancer. Men with history of gum disease are 14% more likely to develop cancer than men with healthy gums. Men with gum disease versus women, 49% would develop kidney cancer against the women, 54% pancreatic cancer, and 30% blood cancers. So, what is the theoretically, what is the culprit behind this? So they have found out it has something to do somehow with oral microbiota. So there is a link between oral and systemic diseases that has encouraged researchers to investigate the influence of oral microorganisms in the development of human cancers. It is well documented in literature that there are indeed significant changes in the abundance of oral microbiota in oral cancer patients compared to healthy individuals. So we have the saliva that plays also a very important role for the oral cavity microbiome balance and for the digestion of food items. So we have what we call as the oral biofilm, and underneath there is a mass of microbiota. If your oral cavity microbiome composition is out of balance, it may cause increased risk of caries, periodontal diseases, fungal infections, and leading to multi-organ diseases. Now, what about oral probiotics? Of course, there are a lot of papers um, that said that it has a therapeutic effect. Okay, it helps to maintain a healthy microbial balance in the mouth and even in our body system. So, how about discussing collaboration with the probiotics on oral microbiomes and microbiota? So the human body hosts 100 trillion of microbes. And the ratio of the presence of microbiota to human cells is 10 is to 1, which is, of course, a big population as compared to human cells. So what is the microbiome? So microbiome is the microbial cells itself plus their genetic materials. So there are the genomes. So microbiota and their genetic materials. So microbiome is the name given to all the genes inside the microbes. So basically, these are the normal flora of bacteria or organisms found inside your oral cavity, and they have there are a lot. So saliva plays a very important role for oral cavity microbiome balance and for digestion of food. So we have four pieces of the puzzle here: the microbiota, the genetics, the immune system, and of course your lifestyle. So WHO defined that probiotics are microorganisms that have positive effects on our human body and have an effect towards other microorganisms. Okay, when taken in adequate amounts, they have been shown to confer health benefits to the host. So the oral health here, there are live microorganisms that produce positive biofilm and create an oral healthy environment when administered, of course, in adequate amount. So according to the clinical dentistry update, we have what we call as the oral lactic acid bacteria and bifidobacteria, and they have been isolated and characterized for various oral health purposes, including caries, periodontal diseases, and even halitosis. So we have the common pathogens, okay, Streptococcus mutans, Actinomyces, some lactobacilli, and of course the main culprit here is the kind of diet that you have. So we have the common pathogens here, which is your oral microbiomes. Okay, so you have the lactobacilli that thrive and may even oust your strep mutans. So lactobacilli from decay can be swallowed and seeded in the digestive tract, and this is how tooth decay causes diseases all over the body. So of course, we have the oral microbiome that communicates with the dental biofilm. So actually, to discuss this, the endpoint here is that your oral probiotics, they antagonize against the pathogen. So it is an antagonism. So they compete with the bad bacteria. So the oral microbiome communicates within the dental film. Oh, I'm so sorry. So So there are a lot of researches that would show us the effects of probiotics. So I'll just have to run this because I know pretty sure that you have heard a lot of lectures regarding effects of probiotics. So I need to mention this because the only probiotics that I came to know that is in the form of oral lozenges is of course the Prolaxan, and I give it to my patients, and I have a very good feedback with those. So again, so aside from the interprofessional collaboration and of course collaboration with the oral microbiome, going back to my scenario, which is patient LY. So after being referred to this highly respectable um, colleague of ours, also a maxillofacial surgeries, the patient underwent oral surgical procedure side by side with the ENT. So here, so what did I do? I took care of the intravenous fluid preparations, the computations, and of course, computed for all the medication that was given to our patient. So again, this is the 7.5-year-old male. Remember that my patient is a little bit malnourished, actually moderately wasted, moderately stunted, as we term it. So what happened to him after me collaborating with the other healthcare providers? I think I already solved the puzzle during that time, yes. So after the operation, so here he is now. So I would say patient LY is so happy. And what about to the body weight? We were able to catch up. Okay, so at this time, like after 2 months, basically I was able to gain the ideal weight for his age. And not only that he is happy, his parents said that he became so sociable in the school. So basically, patient LY, so happy. And of course, with that scenario, I would say that it is nice to embrace collaboration. And I believe that there is beauty in diversity. And then, of course, the characteristic of the victorious is working together in unity. So, God bless you all. Thank you.
Wow. Thank you very much, Doctora. Is that the presentation? Thank you very much. We basically get a lot of information with your topic, interprofessional medical to dental. So really, it is very very important for those who are dentists watching there. Don't hesitate to collaborate with the medical practitioner, Doctora. Tama?
Yes, please.
Um,
Actually, here during our ECQ, we are all practicing interprofessional collaboration. And let me say that it is not just within the healthcare providers, pero this time the community is being involved, the local government. So
mhm.
it is a nationwide collaboration indeed with the different sectors.
Mm. So I think we should start collaborating with your local community doctors there because parang hindi ko pa masyadong nababalitaan yung collaboration ng doktora eh. But I think based on your example, based on the case analysis that you have presented, talaga namang kailangan ang collaboration, especially you've collaborated with oral and maxillofacial dentist po, doktora. Tama?
Mhm.
Po.
Yes. Mm-mm.
So again, for those who are watching right now, maraming salamat po sa mga nanonood, Dr. Kevin. At patuloy na nanonood. If you do have questions, you can always throw it to us. We will take advantage of Doktora. Sasagutin niya yung mga tanong na. Dr. Kevin, Dr. Bell from Marinduque, Dr. Prezi, who is always watching, Dr. Ellen, Dr. CJ, Dr. Elizabeth. We do have a lot of watchers. Dr. Adidas, Dr. Adina Lagman, who's always watching us. Thank you very much. Dr. Gina, Dr. G, Dr. Luz Villanueva. Ito, taga Las Piñas to. Kilala yata ni Dr. Jennifer, Dr. Rufina, Dr. Elisa, Dr. Dizon, Dr. Bea. If you do have information or any other questions that you'd like to throw in, it's we are still here. We are still live, and we are still communicating with our lovely Dr. Lilian. Dr. Lilian, kanina may pinakita kang figure and it is so shocking to me You know why? Because based on the 2011 data that you have, it's already 80% of the Filipino people have dental caries. Do you know? Now 2018, it's 92%. So what do you
Oh,
think? What do you think seems to be the problem on that particular? Kasi instead na bumaba because we do have campaign a lot of educations and still tumaas pa. What do you think? Based on your personal opinion?
okay. Okay. I think it's the early referral system.
Mhm.
Okay, the very first one, of course, that the mother will do is to bring their babies to the pediatrician.
Yes.
And basically, uh, the proper protocol, I would say, the proper or the ethical way also is, of course, to refer
Mm-hmm.
the infant as early as 6 months to a pediatric dentist, or probably I think all the dentists can handle this. They're competent enough to
Mm-hmm.
handle babies. So I guess 6 months, the time that the first tooth eruption occurs, I think that is also the ideal time to make the referrals. The
Doktor,
the
tama,
earliest
tama.
referral.
Mm. Ah, we do have na campaign na sa dentistry, buntis pa lang dapat kasi there's a study was released, actually this was conducted in Canada and University of Odontology in Germany,
Mhm.
that 60 to 70% of pregnant women suffers from gingivitis. You have mentioned a while ago, Doctora, based on the research that you've looked into, yung menopausal is also prone for having gingivitis, correct?
Yes.
Aha.
Mm-mm.
So, go ahead, Doktora. Ano ba ang reason
No,
niya?
no, no. It's because that there is really, if you have a poor oral health, okay, basically it is directly related, or there is a link to poor health system.
Aha.
And the only thing that I could see here, of course, when I am making this presentation, even before, the only thing that I could see to answer all of this is because of the presence of the oral microbiota inside the mouth. Actually, we have a huge number of organisms living in there.
Aha.
So basically, if there are imbalance happening inside your oral cavity, definitely with this imbalance, it could cause gum diseases, dental caries. So basically, there would be inflammation,
Mhm.
okay, of the gums. And when there is inflamed, of course, there would be an increased permeability for the blood to the blood vessels. We have your capillaries, your venules, your arterioles. So there is the possibility of spreading of that pathogen
Infection.
inside the system, aside from being ingested also.
Mm. So, Doctora, we have one comment here, but you can take out your share screen so that you can see the comments. We have Dr. R. An M. Garcia. Thank you, Dental Marketing Philippines, for having this seminar. Yeah, you're very much welcome, Doctora. If you do have questions, you can always throw into us while we try to maximize our beautiful and very good doctor. And we have one here, Doctora. Nababasa mo ba siya dyan?
I have to wear my eyeglasses.
Okay, babasahin ko na lang para sa'yo. Sabi ni Dr. Ruter Olvida,
Okay.
just validate and confirm your statement. Collaboration cure. Thank you, Dental Marketing, Dr. Lilian. No? Tama po, no? Doktora, I would just like, and this is also for the benefit of those who are watching right now. Hindi niyo po
Okay.
natatanong, Dr. Lilian is also a researcher, have conducted several research on probiotics for
Probiotics.
immunity, probiotics for gut, and probiotics for pediatric. That's why
Before the
he was able to talk about probiotics a while ago. So, when do we refer? When do the dentist refer to a medical doctor's pediatrician or any specialty doctor?
Okay. Once you see that there are, of course, gum diseases occurring, and you ought to give antibiotics. Okay. If, of course, if you are not, you don't know because usually in pediatrics we usually compute it by the body weight. Okay. But I think because I already lectured this one to one of your chapters, and yes, I told them that okay, I informed them on how to compute the different antibiotics. But if you are not sure of your computation, oh, I think it's also one of the things that you can, of course, refer it back to us. So that's
Yeah.
the thing. But okay. So aside from that, if you think that there are other problems aside from oral cavities, particularly if the you take note that in taking the history that there is always a recurrence of respiratory infection, um, I think this is a referable one because we have to investigate deeper what is the causing of frequent respiratory infection.
So you're saying, Doctora, that if for the dentists out there, for those who are watching, for those who have experience, because you are the one looking into a dental oral cavity, and also
Mhm.
there is a so-called systemic concerns. Actually, it is correlated. No, there are several systemic
Mhm.
problems that are being correlated with the oral flora. So I think
Mhm.
if there is a chronic or pabalik-balik po yung sakit na hindi naman parang lampas na sa oral no, parang nasa like respiratory, as you've said. I think that is a perfect time to refer or collaborate is the proper word.
Yes.
Yes.
Mhm.
So there's also I've been writing notes, no, you've researched there also that there ito po, it's really a big concern for all of us, for the dentists out there. I think kailangan minsan we have to do exaggeration na, that 14% can we the women can suffer from breast cancer. Correct,
Mhm.
tama? Oh.
Mhm. Mhm.
And 86% those menopausal age might also
Mhm.
have 86% chance of having gingivitis. So dapat alam ng pasyente, doktora. So can you expound more on that?
Okay. We have to go deeper with the mechanism on how this happens. Sometimes there are a lot of things to consider aside from your oral microbiome, especially with women. We have the interplay of hormones also.
Uh-huh. Yes.
So sometimes it plays a risk. The type of diet that they are getting, if are they smokers, are they alcohol drinkers, so this boils down also on the type of immune system that they have.
Mhm. Okay, correct. And also, there's another one, systemic concerns, 33.3% if you're diabetic. So, tama, doktora, nabasa,
Yes.
napakinggan.
Mm.
Mhm.
Because if you are diabetic, the problem here is that when you do your laboratory, especially your fasting blood sugar or your random blood sugar, they are high, and that we are talking of glucose here.
Mhm.
So meaning to say, having a high level of glucose in the body is would create a conducive environment
For the
for
pathogens.
the pathogens to proliferate and
Yeah.
grow.
Yeah. And some more, sabi nga, if they, even if you're diabetic, even if you've tested that you do have a normal glucose level, the tendency is you're still not normal comparing to the normal who doesn't have diabetes. So, sabi nga ganun. So, I think,
So,
Doktora, any other uh, suggestions, recommendation on how they can collaborate. So, for example, if they want to collaborate with you because you're a pediatrician by profession and you're also conducting several research, how they can get through you, or paano ka ba nila mako-contact, or saan ka ba nagpa-practice? Or,
through you.
you can always get in touch with me, pero doktora. So the doctora is practicing in the south, so you can always get.
Yes.
Actually, she actually lectured in several chapters. Also, I think Laguna Dental Chapter. So you can always get through her, and she'll definitely love to do sharing for other chapters. Okay, so Kanina pa, Doktora, last na to, mga dalawang tanong na lang. No? For those who are watching that there, we still have 6 minutes. You can still ask question. So, you've wrong medication, wrong prescription, wrong referral. I've overheard that a while ago.
Oh, yes.
Siguro yung wrong prescription, siguro yung nag-prescribe na hindi pa alam ang computation, because I firmly believe that doctors compute based on the severity, based on the weight, and based on the age of the patients, right, Doktora?
Yes. And those things we call as medical errors.
Mhm.
Mhm.
So talagang nagkakaroon ng error.
Actually, if you are going to make a research on this, kaya lang kasi there would be a legal implications on this. Um, uh, these things are really happening. Yeah, sometimes the way that the doctor prescribes, sometimes you cannot yung sinasabi nila na yung sulat hindi mo
Maintindihan.
parang kalahig ng manok. Sometimes when they go to the pharmacist, so since if they cannot read it, the thing here is without calling the doctor back by the patient, sometimes they're given the wrong medication. So that happens to me once.
Mhm.
But my writings are legible.
So, you are one of the few doctors that can write legibly. Then, and then, so the concerns, Doctora, sometimes the pharmacies, of course, of course, they are also professionals without blaming them.
Yes.
Hindi na tumatawag, no? They usually call the doctor po kung sino nag-prescribe. Usually.
The thing here is sometimes because we don't give out our numbers, right?
Yes.
But the thing here, it should be a practice that, for example, if they cannot really comprehend the handwriting of the doctor, probably it's better to return the prescription back to the patient. But it's quite tedious. It's either
Yes.
the patient can call back their doctors
Mhm.
to clarify things.
I would just like to make mention the message and of Dr. Melody Mendoza Rivera, dentist. Thank you very much, Dental Marketing Philippines, Sir Roche, and of course, thank you, Dr. Lilian, for this seminar. And also, ang problema rin po minsan sa prescription na yan, because a lot of patients are trying to abuse, overuse of antibiotics will definitely increase the certain level of resistance in the system. I think
Yes.
when I was still doing a lecture for medical doctors, I think I've been doing I've said that there are 1,500 antibiotic resistant cases every day. So I don't know today, hindi ko na alam. So hindi na ako nasa medical ngayon. So nasa dental na ako, Doktora. So we still have that kind of problem, Doktora.
Yes, and that's where I usually use probiotics.
Yeah. So yan, nasabi mo, Doktora.
As an adjunct treatment, side by side with the antibiotics. Yes.
So when are you gonna give probiotics before going into antibiotics? So that is a commonly asked question for sa kailan ba?
Okay, it's a case-to-case basis. If you think that the patient's immune system can still handle the type of, for example, if the disease is just mild, for example, just a plain simple flu, okay, cough, colds, fever. So we have to observe it for 3 days if it's because the number one thing that you have to entertain first is viral.
Mm-hmm.
So in my practice, I usually give probiotics as part of my adjunct treatment.
So this is not, Doktora, this is not oral probiotics, just a medical probiotics, yeah.
Yes,
medical probiotics, not the dental probiotics.
No. So with that, okay, if there's a need, for example, if after 3 days, definitely, I would ask the mother, or I'll ask the mother to make an update. If it's still after the 3 days of observation or on the fourth day, it is quite still persistent. So that's the time that I think there is a super infection of bacteria. That's the time that I would give um, antibiotics. But I would tell them to still continue the probiotics because the thing here is sometimes some kids they develop gastric irritations.
Mm-hmm.
Okay, And probiotics is very helpful in preventing antibiotic related gastric irritations like diarrhea.
Mhm.
So that's one. And
So,
there's
yeah,
already a paper for that.
yeah. Many scientific papers, diarrhea, mucositis, UTI. So these are
Mm.
some parang alam na alam ko din konti. No, anyway, so thank you very much, Doctora. So I think we have come to a tail end of this discussion. Thank you very much for those who have watched. Actually, parang bitin ako eh.
Really?
So I think we have taken so much time, Dr. Lilian. Any final message to all the dentists on how we collaborate, how we do interprofessional, medical to dental, dental to medical? Any final word, Dr.
Um, so I guess to have the best healthcare system delivery, I would really suggest to embrace collaboration. I know that we have sometimes different point of views, different perspective, but with the kind of thing that happened to my patient, remember, patient LY, it's not a decision of referring them at a later part. So at the time, my decision is to do the referral now.
Mm-hmm.
So that's it.
Okay. Okay.
So yeah,
Okay, so with that, thank you very much, Doktora. Maraming salamat sa pagkakataong binigay mo sa amin, Dental Marketing Philippines. I think we have learned a lot. All the dentists, all my beloved dentists have learned a lot from this lecture collaboration, and we do appreciate your continued support to yours truly, to me, and to my Dental Marketing Philippines. I hope we can see each other after this pandemic. And stay
sure.
beautiful, stay safe, stay sexy. Ano pa ba? Yan, stay lovely, and stay safe, Doktora. Doktora, thank you very much. Maraming salamat. I have to say goodbye tonight. And maraming salamat, Doktora.
Thank you so much, and truly, I appreciate the session. Thank you so much. Okay.
Okay, so with that, we're done again with a very good presentation. Interprofessional, medical to dental or dental to medical. Don't hesitate to refer. Don't hesitate to ask your medical doctors. I know you do have a lot of friends who's very much willing to support you. At this time, I'm going to invite you on May 7. So this is going to be May 7. I'm inviting all of you. This is our friend, the dental architect, no? The dental architect, he's a very good doctor, very good cosmetic doctor, but this time he's going to be showing us some dental ergonomics. So you need this. Definitely all the dentists need this, and hope to see you there. Hope to see you on May 7th at this time slot, 6 p.m. Maraming salamat po sa inyong suporta. With that, I'd like to say goodbye for tonight, and I'll see you around. Watch, share, and keep on following Dental Marketing Philippines. Magandang gabi po.